midterm. You can say, Nuki, how we're going to do that? That's a lot of chapters. When they give you test questions to do with your midterm, they actually take a certain amount of questions from each chapter. That makes sense. That's the way I used to do it. Okay. When you get your state, when you finish the end this course and you do your final, hopefully they'll do things like I used to do also and other instructors. We mimic the state. In other words, if the state has 110 questions with 10 pilot questions, don't count, and they give you 100 questions that count, if they have 10 CPR, we would give you 10 or 20 questions to do with CPR. Our finals mostly would be 200 questions. I don't know what they told you your final is going to be. Okay, but make sure you know they're going to try to mimic the state because you're at the end that you need to know all these chapters. Are you going to remember every chapter, everybody? No. Are you going to remember 100% of this book? No. Would you know at least 99% of this book, this textbook? Yes, you will. You will know a lot that you need to go back to and understand. So whatever I do, every review with you, I recommend that for even your final, you go back to the chapters we went prior on the recordings and review that also. I will go through everything with you, mostly also for your final, okay, when it gets to that, because we meet every Sunday. With the class, I meet every Friday. So we're going to be doing that also. So we make sure you go back to these reviews. They will help you. Today, especially, when you upload this from your WhatsApp, take notes, okay? Because today I'm going to go over the certain things. Now, for instance, let's go with the first 4 chapters. New York State calls it preparatory, okay? They give you the first 4 chapters. They always actually test questions on. Of course, there's scrambled, but we're going to get something similar like that. You know, the first 4 chapters was to do with the introduction of EMT, the EMS system, and so forth, and the well-being of the EMT. If I ask you this, just like COVID, what is the best way to prevent you from getting any kind of fluids or bloodborne pathogens on you? What is the best way to prevent that?
BSI and hand washing.
BSI. Now, BSI and hand washing. You see how you come out and automatically you're thinking BSI and hand washing, body substance isolation, right? We know that, and hand washing. So we will give you a test question to do with standard precautions, okay, or standard cautions. You think of the CDC once you see that, right? CDC, Center for Disease Control. The number one they said is the best thing is hand washing. So you need to know about hand washing. You know, you need to know the BSI. If I say to you, what's another form of you protecting yourself to do with PPE? What do I mean by that? What is PPE?
Personal protective equipment.
That's right, your personal protective equipment. Can you name anyone?
Like any of this PPE?
Yeah.
Like eye glasses with the sides on them, face mask.
Okay.
Gloves, I guess.
Okay, what else? Get into the other stuff we teach you. That's according to the CDC for fluids and blood. Give me other stuff.
The bunker gear, traffic vests,
gowns, things like that. But you think of everything up: leather gloves, your helmet, your boots, your bunker gear with the nice jacket with the reflectors on it, and your bunker pants. All these things you wear, they consider that a form of PPE also that you need to know. Okay, but if they get specific for the other one, you know what to go to. BSI. You need your gloves. Excuse me, gloves. You need your goggles. You need your gloves, and you need your face mask. What type of face mask they recommend according for the EMT to wear?
Is it
N95, right? And then goggles. I like what one of you just said. I think it was Ian. I'm not sure if it was Ian or Jason. One of you said, because I was trying to keep up with the yellow when it lights up. He said he likes the glass that even go to the side or covers the side also, which you want to cover everything. What are you basically covering in front of your face?
Your
mucous membranes.
Mucous membranes. Excellent. Mucous membranes. 5 locations of mucous membranes. Give it to me.
Nose,
Eyes is one of them. Conjunctiva. What else? Someone just said
Nose.
Next at the nose.
Ears.
Mouth.
Mouth, not the ears. Mouth.
Ears, my bad.
Okay, according to the book, going straight to the book. So these are eyes, conjunctiva, inside the nose, inside the mouth, and the other two that's located in the bottom.
1% and the opposite, the 1%.
I like it. You could just say, Lewis, the anus in the vagina. Don't be embarrassed here for anyone here. All you ladies and gentlemen are going to be future EMTs. Okay. And we're all at that age that there's something to be embarrassed about using medical terminology. Excellent. So you know about the mucous membranes. The state always asks that. Class would ask a test question like that. All the following part of the mucous membranes except. And the ones I always see on the class questions or the state is the lips. No mucous membranes, okay? They ask you what's the thinnest to do with the thickness of the skin. Then it's your eyelids and it's your lips and the back of the heel of your foot, things like that. That's all textbook. But it's rarely they will ask you a question like that if they do. Let's get into more. Can anyone tell me, what does the EMD do? EMD. What is an EMD? 3 letters. That's right. And what is the main function of that EMD? You should know
Like
this.
EMT to the patient.
Besides that, and you're right, Lewis, they do. They will give information to the EMT about the patient, location, and everything. But what mostly EMDs really do?
Take 911 calls.
They make patient contact via communication, right? But they give life-saving instructions. Okay, that's always a state test question. Could be a class question, know what the EMD does, know what the EMT does, emergency medical technician. The EMR, okay, separated from the certified first responder for the state. The state got 5 levels of training. You got the CFR, the EMT, the EMTI, EMTCC, and the paramedic. That's the state. The book teaches you 4. They will always ask you, depending in class, what are the 4 nationally? EMR, EMT, AEMT, paramedic. Okay, you need to go back to your book and know what each one does. And look for specific words like basic, extensive, advanced. Okay, that will separate there. Remember, out of anywhere from national or the 5 from the state, the CFR from the state or the EMR nationally do not transport. That's how they get you. Because you think it automatically, oh, they transport. No. Anytime you think of a CFR, New York State or New York City, or you think of nationally, the EMRs or the certified first responders do not transport. Think of them as firefighters, park rangers, police officers do not transport. EMTs and so forth do. You need to know that. So EMTs, AEMTs, and paramedics, national. State, you know the 5. Know the difference of what they do. Separate the wording there. We're going to notice we're going to get into a lot of 3 letters, a lot of mnemonics. What does CQI mean?
Continuous quality improvement.
Continuous quality improvement.
That's right, continuous quality improvement. All my years of doing this, and I know that CQI talks about everything from research to training and so forth. You need to know for the basic EMT at least, remediation. That's the top word I always see to do with test questions. You know what they do a lot? Remediation. They retrain the patient, the EMT, because they don't want to automatically fire you. They actually want to help you so you can keep your job because you did something wrong. Okay. Now, when you do something wrong, and a lawyer could prove this, they prove the word what we call negligence. Separate negligence from abandonment. They always love to give you these test questions, class or the state. What are the major 4 things you need to prove negligence? The lawyer.
Causation.
Say it again, Lewis.
I know causation is one of them.
Causation is definitely one of them. That causation goes there that you need to know. Causation is definitely one of them. What
Damages.
That's the last one.
damages with injury? Damages, injuries, keep those together. Okay? I want you to make it easier for you. Okay, hi Stephanie. Good to have
Hello.
you. Or don't forget to sign in. Very important. Okay, if you guys and ladies didn't. Okay, because you know they're going to ask who came into this review. Now remember this: 4 things. Did that EMT have a duty to act? Breach their duty, causation, and that's at the end. I want you to know injury and damages is next. Okay, so you could put that like forward slash or backward slash, whatever. So it should be duty to act, breach of duty, injury with damages, causation. Those are the 4. You have to know that. Very important. They always love to ask you on that. All right. So know those 4. Negligence. Now that word abandonment, they love, and we love to, especially me as one of the senior instructors, love to throw the word abandonment there to try to confuse you a little bit. Abandonment, I want you to think of, they made patient contact and then they went and did something else with another patient. So a good example would be treating a patient for a broken arm in front of a building, and then maybe not even halfway down or a block away, someone's waving to you that someone just got stabbed or something. And you and your partner leave your patient and say, we'll be right back. You just started treating that patient. Okay? If you leave that patient, go to the other patient, that's abandonment. Okay? Now, I'm going to ask you this and see how your thought process is. You go to a home, the door's open. You see the patient from a distance lying on the floor or even on the bed. You don't know what's their condition, but your detector for carbon monoxide goes off. It rings, but you carry on, okay? You turn around, you call the fire department, hazmat, and so forth, because you cannot enter that. Is that abandonment?
No,
Excellent. Why is it not abandonment?
you didn't make patient contact.
There you go. Okay? You seen a patient, but you physically did not make patient contact. If you made patient contact and you started treating that patient, and then your detector went off and you left that patient, that's abandonment. Okay? When it comes to your safety, okay, if they give you a test question, this class of state, even if a perpetrator came back to shoot a person he shot, and you're treating that patient, and that perpetrator is coming back with that gun to finish the job, and you and I, me and Lewis or me and Nick say, we're gone, and we left the patient there. It's not abandonment because of our safety. Safety is priority first. You and your partner, then the patient and the bystanders. That's how we do it. Okay, so remember, know those words. So you need to know the words to do with abandonment and negligence and so forth. Okay, make sure in your book and the chapters, you highlight that and know that. They always love to ask you test questions like this. You got CQI, you know CQI, you know the EMD, and you know all the different levels that you need to know to do with the EMT. Okay, EMT, AEMT, and paramedic, and then before that, the EMR, which is emergency medical first emergency medical responder. Know the difference to do with national and then to do with the state. Now, when I call the doctor, what is that doctor, male or female? They located somewhere. What is that doctor? What do we call that doctor?
Medical control.
Yeah, medical
Director.
control.
We call them at medical control, but they're the medical director. Okay, remember that word. They love to get you on that. When you see a word like telemetry, New York City wise, we use telemetry as medical control. Do not confuse these two. When it comes to the book, telemetry, I want you to think of like digital, transfer it like a fax. Okay, that's the way I want you to know that. But you need to know that when we come into communications, which we're going to be doing also. You notice I'm going to be going over certain things that you need to know because it's going to cover every chapter that we need to know that's very important here, okay? So let's think of the medical director. If I needed to get a consult with the medical director, when I speak to him, what is that called? We gave you certain words that you know when you're contacting and speaking to that doctor, it is something we call it. What is it?
Online?
Online. Right.
Online.
Right? Online. With direct. So the words they use is direct or online. So you'll get that consult. You know that. If I do not speak to the doctor at all, I am blank, blank. And I follow these things. What is it?
Standing orders.
Offline or standard procedures?
That's right. You're offline and you're following those standard procedures, which is probably your protocols or your standing orders. You got that? Remember those words, standing orders, protocols. Those two come together. Okay? So you need to know what offline means and online means. Know that if I say online is direct. If I say offline, it's indirect. If I'm indirect, I'm not talking to doctor, I must follow protocols or standard procedures or standing orders. If I remember correctly, New York State-wise always say standing orders. Okay. I think your book talks about follow local protocols. I think the way the book says it. Okay. So make sure you know that. So you know that, what that means there. Yes, Kenny, you had a question? Okay. You go reaching up there, so you confuse me sometimes. Now, all this that you learn, this book that you've been doing, JB, been out over 50 years. Okay. Over 50 years, since 1971. It's like 51, 52 years now. This whole curriculum was brought to us, the EMS community, by whom?
Department of Transportation.
Thank you, Devin. Know that. Always a test question state in class. Department of Transportation. Those three letters again. You notice three letters come out again, right? Those are three letters, Department of Transportation. So if I give you something, and we spoke about this one already, we said CDC. You know it as what?
Center of Disease Control.
Center for Disease Control. And they follow everything to do with what we stated earlier that you got to be careful for. They tell me always wash your hands after, because this can you get in contact with all the time.
Infection control.
Well, okay, so talk to me. Give me more, Lewis.
Contagions.
Say that again.
Contagions.
Yes. Okay. What form of contagions, Ian?
Oh, pathogens, I guess.
Yeah, bloodborne pathogens or fluids, right? So they follow that and they use the word standard cautions. Okay. So remember your BSI, because the CDC, bloodborne pathogens you're thinking about, and you're thinking about also fluids, urine, feces, things like that. Make sure you always wear your gloves. The three things they're always going to ask you: gloves, goggles, face shield. N95 for us. That's what Kenny said earlier also. And he's right. Surgical mask, I could throw that on a patient, right? You see a lot of people wear that out now. When they tell you to go to certain places, they tell you to use the surgical mask. Surgical mask could only do so much, right? When a person coughs or sneezes, it catches it, okay? The N95 mask is for us. So if they cough or sneeze or something's in the air, those particles are not supposed to go through that N95 mask, okay? So that's why we as EMTs and paramedics wear that. So know the N95, no CDC, no BSI, no PPE, okay? You have to know these things, very important. Does anyone know the word OSHA means? OSHA.
Occupational
Go ahead, occupational.
standard.
Hazard Safety Association.
Occupational Safety and Health Association or Administration, right? No OSHA. OSHA, if they ask you a question to do with OSHA and CDC, know the difference, okay? OSHA, you're thinking about, you go and wash your hands in a place and the shelf is too low and you hit your head and you get cut or you bump your head there and there. That's an OSHA violation. Why? Because that level of that cabinet is supposed to be at a certain level. If there's a hole in the floor, okay, and you trip and you hurt yourself, another thing you need to know about that, okay? So no OSHA and things like that. We got the PPE, we got the BSI and so forth. So make sure you know that we spoke about that. We know that the number one thing you do is hand washing. Okay. There's things that they give you to do with stress. Now, stress is good. Stress can be bad depending what kind of stress it is, right? Because stress makes you who you are right now. Okay. Do we know and understand the main different three types of stress? And what are they?
Eustress, de-stress, and something else.
Okay. There's that one. I'm talking about the other ones.
Is
If I
like
take
is post traumatic stress one of them?
Say that again, Ian.
Post traumatic stress, is that one of them?
Well, the post-traumatic stress, that condition that they may ask you. The
Mookie, what
three
about
stress I want
eustress?
you to know is they always ask is
Cumulative.
acute, delayed, and cumulative. Okay, those three: acute stress, delayed stress, and cumulative stress. They may ask you post-traumatic stress disorder, PTSD, or they may ask you a word burnout. Okay, but the ones I always see that comes out is the first three: acute, delayed, or cumulative stress. No, all three of those. The ones I see a lot is that cumulative stress. Okay, what do I mean by cumulative stress?
Stress over time.
Yes, it is stress over time, but what is the difference between an acute stress and cumulative stress?
Acute is like the stress that you feel like on the job at this second, and then cumulative is
that.
like after a couple months, like stress is building, and then something happens to you because of like the stress that happens from the job.
Okay, you could do that, but I want you to do that with more than that. So to make it easier for you, acute, just like you said right now, happens right then and there. Okay. The delayed one, it could be hours to maybe days later. Okay, that's your delayed stress. When it happens and everything is piling up, that's cumulative stress. So the easiest way to separate that when they ask you a test question, you saw your partner get hit by a car, okay, right in front of you, okay? That's one stressor. A few days later, a family member dies, another stressor. A few days later or a week later, another stressor comes out there that one of your family members or your abuelita, your grandmother, God forbid, is getting thrown out her apartment, and this affects you. You have stress after stress after stress, and they all come together. Cumulative stress. That's the easiest way to separate it when it comes to test questions. Okay? Any questions on that? Good. Excellent. Can you give me some signs of having stress?
Irritability.
Oh, I like that. Irritability. That's one of the main ones. What else?
Passion fatigue.
Yes. You could be fatigue and so forth. What can you lose?
Sleep.
Sleep. Excellent, Nick. That's right. You can have what they call a form of what I think is the word insomnia, if I remember correctly, right? Right. You could be also a person who, not the way you used to be with others. You used to communicate and talk, and now you feel a little more withdrawn away from that person, things away from the family. You don't want to do what you used to do, and so forth. Know the signs and symptoms of stress. Okay, very important that when you get back to it, when you're looking at the textbook, know signs and symptoms. Remember, the good ENT is going to know the signs and symptoms of their patients. That's how you're going to get to become a great EMT and a paramedic in the future, or nurse or doctor or PA. You need to know the signs and symptoms. It's very important. Please, did everybody sign in? I just want to make sure because I sent out the poll. Yes, I see everybody so far, so good. I'll leave it up for another few minutes in case anyone comes in late, and then we could close it. Not bad at all. Can anyone tell me what's a DNR?
Do not resuscitate order.
That's beautiful. Do not resuscitate. So when you do not resuscitate, what are some ways that they could show you or you could see a DNR?
Bracelet.
Official document.
Bracelet, official document. What do you mean by official document?
Like a paper signed by like a medical doctor, or like basically a doctor. Yeah.
Okay, you're on the right track, Louis. You're on. that paperwork, that medical documentation, that DNR form has to say non-hospital. Non-hospital DNR. That's how they're going to get to you. Make sure you know that. Non-hospital DNR. It must be signed by the doctor and the patient. Okay? It must have the date on it, and it cannot be expired according to protocol. Okay? You must know that. So don't forget. It could be in the patient's wallet, little card. It could be a bracelet, or it could be that piece of paper, that form. You must know all of those and know what the DNR is. Can someone tell me if you see a person that is definitive signs of death, like they're dead? What do you see when you know that the person's dead? That you don't need to start CPR. Oh, that's the number one, right? I had that. My favorite one. I had 4 of those in my EMS career. 4 heads,
Rigor
right?
mortis.
Nervous, to tell you the truth, I was more excited. It was cool.
I said rigor mortis, but yeah.
No, you said rigor mortis. I thought you said you were comfortable. I'm sorry. No, I
Never
apologize
comfortable.
with that. My first decapitation, yeah, EMT. I was like 2 or 3 years into the job with HAC, and 1994. And they said, Nuki, what was that? And I said, decapitation, and the head was right off. It was a former boxer. He fell in between the tracks and took his head off, and his head was here and his body was there. And everybody, do you guys remember or heard about the Polaroid cameras? They used to take it and shake it, and then it used to pop up and show the film of the person. You ever heard of Polaroids? If you
I
didn't, don't
still
worry.
use them.
But if you ever heard of it, I had my 2 fingers holding the head for the police officer who was taking a picture of the patient's face. So that's why I'll never forget the decaps, bro.
Nuki, I have a question.
Yes, John.
When you and your partner arrived to that scene, did you mark the time of death right away?
We have to. Yes. Excellent. Remember, we fall under the doctor's license. Okay. So technically, are we allowed under the doctor's license to really pronounce death? Really, a doctor's the only one who could do that. But since we're his eyes and ears or her eyes and ears, we give a pre-assumptive diagnosis. That's the words we use. That's what's on your ACR. So yes, we would do it. We would get all the information, and then we would say pronounced time is 18:35 hours, like I see on my computer, meaning 6:35 in the evening, let's say. So yes, but you always have to do and make sure you have all those signs. So one of you said decapitation. I think someone said rigor mortis. What else?
Lividity?
Yeah, dependability.
Dependability.
That's right. You have to know these words. The ones they love to always give you is decomposition or putrefaction. They combine those words. Make sure you know that. So we may give you test questions. What's another word for putrefaction? You need to know that decomposition. Okay, so know those definitive signs of death and when you would not start CPR and so forth. Okay, so we know the DNR. We know about negligence. We know about the word abandonment. Okay, I want to make sure you know that. We know definitive evidence and death, the signs of what we see. Also, you mentioned a bunch of that. Now, majority of you are going to need to know this, and they always ask you this. When I communicate, right now we are communicating with each other. We could see each other, we could hear and listen, right? And respond to one another here. That's a form of what kind of communication? Is it simplex, duplex, multiplex? What is it?
Closed loop.
Say it again, Louis.
Closed loop.
I can't hear you like you, Berg.
Closed loop.
You said sloop?
No. Yeah,
Multiplex,
closed.
I think, right?
A closed loop? No, I don't want to say it like that. There's another word that your book talks about that I mentioned, simplex, duplex,
I think it's
And-
multiplex.
and multiplex. I just do in multiplex to see if I could confuse you. What would it be
Oh,
with?
never mind.
It'd be duplex, right?
Yeah,
Yes. Why duplex?
because we can talk at the same time.
Yes. You need to know that simplex is a form of push to talk. Think of all the devices that you do push to talk. You're at a base station, right? You press a button, you hold it for a few seconds, you talk, then you let go, then you got to wait till the response of on the other side, right? That's a form. The other two that they always ask you test questions on to do with simplex or push to talk is the portable radio and the mobile radio. Okay, know those two. That's a form of push to talk. PTT, push to talk. That's your simplex. The duplex that we are doing right now, a form of duplex, simultaneously communicating with each other, listening, responding, and everything. That is your duplex. Okay. I do in a multiplex in there to see I could confuse you. I just want you to know the simplex and the duplex. What is a repeater?
Something that takes a radio signal and then repeats it onto different frequencies.
That's right. It goes from one to the other. Repeaters, to know the word repeater. What is a dedicated line or hotline? Dedicated line or hotline?
It's a frequency that is reserved for a specific group of people.
That's right. So that one specific, I want you to think of like the bat phone. If you ever watched Batman and Robin, okay, or you ever watched anything with Commissioner Gordon, think of that dedicated line, a hotline, just like that. No outside interference. So majority of the time, unless you have the phone number to the ER like I used to, I would go straight, give a notification straight, doing that hotline, their dedicated line, and call the ER and say, this is paramedic Nuki, this is what I have, be prepared, whatever hospital it was. So if you cannot do something then, and you want to give a notification, and you can, you'll call your dispatcher and they'll do that, and they'll utilize that so-called hotline or dedicated line. You need to know words like that. Very important to understand that. So you got simplex, duplex, hotline or dedicated line. What is telemetry?
Dispatch.
Say that again, Louis.
Dispatch.
Is we think it's dispatch. I want you to be careful with that. We think it's medical control also, because state and city-wise, we use that word as telemetry to do with class. If you've been on a rotation here recently, any rotation to do what you're supposed to do that 10 hours or more, okay, city and the state, they use the word telemetry to meaning medical control, but I do not want you to use that. Book-wise, I want you to use the word telemetry like a fax machine, some kind of digital communication. You got that? So if they ask you telemetry, please separate that from how we know it to do with New York City, okay, or a form of medical control. Medical control keeps separate. Medical director keeps separate. Telemetry keeps separate. Think of telemetry to do with like a fax machine that they could transfer an EKG to the hospital, whatever they need to. You follow me? That's what you need to know. Please keep that, because a lot of us, and it always happens, we get used to using telemetry as medical control. And it's incorrect when it comes to questions to do with your textbook. Okay, so make sure you know that, just in case they ask you that. Okay, if I say cholecystitis, appendicitis, diverticulitis, pancreatitis, all those 4 words, what do they have in common? You notice that, right? So it comes into medical terminology that you must know a lot of words, okay? If I give you this, you tell me what is it? Give me the medical word for blue.
Saya.
Cyanosis, right? There you go. Cyanosis, cyanotic, and so forth. If I said red,
Euro.
you could use euro. Some people will use that, or they use the word the skin color to do with flush, right? depending, right? But you can use urine, or if I say blood cells, I can see you going with like erythrocytes and so forth. If I say white blood cells,
Leukocytes.
leukocytes, Luke, right? So these are terms you need to know. It is very difficult to go to every single one that you need to know, okay? But the way I used to do it, whatever I knew, prefix or suffix, I just look at it real quick and I skip it. The ones I really didn't remember or understood correctly, I will highlight it. That's the way I used to do it. You could do it either way you want, but you need to know everything I just spoke about. So if I give you a word like lung, what will be your prefix or suffix for that?
Pneumo?
Pneumo.
Pneumo, right? Like a pneumothorax, right? Pneumo meaning lung. If I say bone,
Osteo.
osteo could be.
Osteo.
That's right. Or ortho, right? Some people would like
Ortho.
to say orthopedic, to do with bones and things like that. So go to your book and you highlight this. How about if I say blood?
Oh,
Emo.
emo.
Hemo.
Right? What else besides emo? What else did people use to describe blood or bleeding?
Sanguination.
Hemorrhage.
Oh, hemorrhage.
Stagnation, yes, you can. That's another one.
Hematitis?
Oh, yes, they can. Yes, you can. So these are things you need to know just in case. So we covered a few. We already did like inflammation. That's the itis. I always wonder when I was a young man why my English teacher says I got nucleitis. Then I understand what she meant. When I look up the word itis, I said, that's not right, Miss McKenzie. Why do you have nucleitis? Then I figured out, and I was in elementary school. So you live and learn. So these are things I definitely want you to know. Give me this sound, okay? You must know this sound. I say the word, you give me the sound. Tongue blocking airway.
Snoring.
Snoring, okay? Swelling or angioedema, upper airway.
Writer.
Stridor, right? Because you're thinking angioedema, you're thinking swelling, right? To do with the upper airway, you get that stridor sound. Upon inspiration, the word stridor, remember that, and think of the high-pitched musical ka or crowing sound, okay? Make sure you know that. Always to do with stridor, upper airway. If I say fluid in the lungs,
Rails?
rails or
Wheezing.
crackling. They use the word rails, crackling. Now, if I say the patient has fluid in the lungs, you would use another fancy word that we say describe that condition. Blank, blank. No, not pneumothorax. Nick?
Pulmonary edema.
Pulmonary edema. Fluid in the lungs. Fluid outside the lungs, pleural infusion. Pleural infusion. That's been your old respiratory emergencies. If you remember that, could be a test question. Fluid outside the lungs, pleural infusion with the E. Okay, make sure you know these conditions. Okay, noisy sound, lower airway, noisy congestion sound. What is the word I'm looking for? It starts with the letter R.
Bronchi.
Bronchi. Bronchi, you see? Constriction of the bronchioles, inflammation, or mucus. What sound does it cause?
Wheezing?
Wheezing. Thank you, John. Wheezing. Okay. So you need to know this word. Coughing up blood. Give me the word.
Hemoptysis.
Hemoptysis. Vomiting up blood.
Hematemesis.
Yeah,
Hematemesis. You see? What I like about this, and I thank you all who are writing it down or saying it, okay? Participation here is big because when you all get this, once I upload it, it's an excellent review, okay? How about black tarry stew? Comes out.
Melano?
Melana. Melana, excellent. Hi, Maria and Steph and everybody and all the ladies here. 'Cause
Hi.
some I don't, but it's good to see you all. Okay. So when I cough up, if I had congestion heart failure or I had acute pulmonary edema, okay, I have this productive cough and it comes up. What is that so-called phlegm called?
Sputum.
Sputum. Sputum. Remember, look at that comes out when you see the word like productive cough or coughing, depending on the patient, think of the word sputum. So we went to a lot of these words, okay? What's another word for heart muscle?
Cardiac muscle.
You could call it the cardiac muscle, or you could call it the myocardium and so forth, right? There's terms you need to know. Remember to separate words like myocardium, endocardium, pericardium, things like that. Okay, they may ask you. If they ask you the myocardium, you know it's to do with the heart muscle itself. Okay, but then if they get more into detail, you need to know the layers of the heart. Okay, so just in case they ask you, you got the epicardium, you got the endocardium. Of course, you have the pericardium that surrounds the heart, the pericardium sac, okay, that surrounds the heart. If you see that, test questions, I always want you to think when there's a problem with that, with blood is when it's not supposed to be, cardiac tamponade, a form of obstructed shock. We're going to get into that when we get into shocks, okay? Right now, you are all breathing what percentage of air inside?
21%.
21%.
And you breathe out?
16.
Excellent. Know those numbers. They always love to ask you those numbers. Now, let's get more into a little bit of airway here, okay? If you're breathing in 16, the ambiance air right now in our rooms, okay, that 21%, and we breathe out 16. My next question is, there are two processes of breathing. What are the two processes of breathing?
Ventilations and respirations.
We think it's ventilation and respirations.
Oh no, it's
But when they ask you the processes, John, or whoever was trying to answer that before, I want you to think of active and passive. And look for these words, inhalation and exhalation. Okay? So the test question may be, what are the two processes of breathing? If you don't see the word active and passive, then I want you to pick the word inhalation and exhalation. Okay? Can they put, what's the other one? Inspiration and expiration? The answer is yes. Mostly they will ask you, what are the processes of breathing? And I always see the test question, inhalation and exhalation. Now they get further. When you breathe, okay, we know that you breathe and you use a lot of muscles, right? But they may ask you, well, one of you just said, like a form of breathing in and out, active and passive. The main muscles they talk about is your diaphragm, contracts downward and flattens, and your intercostal muscles and your rib cage goes up and outward. Those are the words you need to know when you see the word inhalation or breathing and so forth. If they get into the other two words you just stated, I just heard respirations and I think you said ventilations. You need to know respirations, the two exchanges of gases, oxygen and carbon dioxide. Always ask you test questions on that. If they say ventilations, the ambiance air in this room, that 21%, okay, how you get it, what devices? Non-rebreather, right? Or nasal cannula. If they say you're ventilating, a form of ventilation, I want you to think of the other three. Can anyone name the other three devices that we do a form of ventilations? BVM is one of them. Give me another one.
Nasal cannula.
Say that again.
Nasal cannula.
No, we think is a nasal cannula. Nasal cannula is when you give them to breathe like the non-rebreather. I'm talking when you're physically doing a form of ventilations. We said, someone just said CPAP? Yeah, CPAP. So BVM, CPAP. What is the one we forget all the time? That's right. that pocket face mask. So think of those major three. If they ask you about that, you need to know about them. If we ask you test questions on the BVM, you need to know that each one of these devices, you need to know the percentage. We always love to ask you 1 to 6 liters is 24 to 44% on a nasal cannula. The BVM and everything else, we try to give you, like the non-rebreather or the BVM, when we give it oxygen, what they teach you or taught you in class, 15 liters non-rebreather, right? 100%. But you never actually give 100%. When is the only way when you actually give it 100%?
CPAP, maybe?
We think it's CPAP. No. What else?
Is it BVM?
It could be the BVM, but what must be done with the BVM also in order for you to give 100%, just like a ventilator machine?
A proper
Huh?
seat.
Besides the reservoir, what else that patient has to have happened to that patient that a medic has to be there and do?
Oh, intubation.
Intubation. Just think of intubation like a ventilatory machine at the hospital. That machine that when they do a stoma, which is the hole, the opening, and they put that endotracheal tube down, or they do some form of tracheotomy, okay? And they have that ventilator and you hear the machine do this. You ever see it on TV, right? That person's getting 100% in the hospital, right? Makes sense? The thing is, when us as EMTs and paramedics, in order for a patient to actually get the 100%, they have to be intubated. You squeeze in the bag, hook up to oxygen, reservoir is there, and everything. Then that's 100%. It's like a ventilator at the hospital. Otherwise than that, do you give 90 plus, close to 100%? Yes. They may ask you numbers. They may not. Okay. What is the word tidal volume?
The amount of air taken in on a single breath.
Yeah. Amount of air taken a single breath, breathing in and out. When I squeeze a bag, what is the volume and mostly that you will have with a patient when they normally breathe and the BVM?
It'd be 500 in a normal person, and then the bag's 1,500.
The average, I want you to go with 500 and 1,000.
1,000.
Got that? 500 and 1,000. So if you think about that, 500 and 1,000 is what the average they want you to make sure you know and understand. Okay. When you are losing blood externally or internally, you go into a form of what?
Hypovolemic.
It could be hemorrhagic shock externally or internally, right? Or hypovolemic shock. The question is here, are you comfortable and know all the shock? You need to know hypovolemic shock. Give me the other 3 ways a patient could go into hypovolemic shock. Let's say to do with fluid. I don't want you to do with blood yet. Give me diarrhea.
Excessive vomiting.
Loss.
You said excessive vomiting, yes. And someone just said something. Say that again, Kenny?
Plasma.
Plasma loss.
That's right. Plasma loss to do with burns.
Burns, yep.
They only ask you hypovolemic shock to do with fluid. You know the 3 fluids, the 3 main ones. Okay. If they ask you to do with blood, you know that's hemorrhagic shock. That's another way because hypovolemic shock covers fluid loss and blood loss. Okay. You know that. Now let's get into this one. Give me the main 3 of obstructive shock. The main 3. What are the main 3?
Tamponade.
Cardiac tamponade is one of them. Excellent. What else?
Tension pneumo.
Tension pneumothorax.
And what else?
Acute pulmonary embolism.
That's right. Remember the CAT. You have to know that. That's the ones they always ask. Okay, so if you know the mnemonic CAT, you got all 3. Are you comfortable, all of you, with all 3? Cardiac tamponade or precardial tamponade? Are you comfortable with acute pulmonary embolism? And are you comfortable with tension pneumothorax? If not, we go over all three. I need to know if all of you are comfortable with that, of obstructive shock, the signs and symptoms, because they may ask you that. You know cardiac tamponade. What is the main three things we're looking for cardiac tamponade?
Beck's triad.
Excellent. Beck's triad. JVD, muffled heart sounds, and narrow impulse pressures mean that the systolic and diastolic are coming close together. Okay? Beck's triad. You must know that for cardiac tamponade. What are the signs and symptoms then for the acute pulmonary embolism? Don't go crazy.
Air in the lungs.
Well, we know it's a form of blockage, right? Obstruction. But give me signs and symptoms. If I had acute pulmonary embolism, you know, most likely the pain started in my lower extremity on the legs, traveled up to my heart on the right side, and went in from the inferior vena cava to the right atrium, to the down the tricuspid, into the right ventricle, up the pulmonary valve, and got stuck at the pulmonary arteries or at the lungs. What am I going to show as signs and symptoms?
Shortness of breath.
Say that again, Pamish?
Shortness of breath, or like
Yes. Shortness of
tripod
breath, for
breathing.
sure. Difficulty breathing, shortness of breath, SOB, right? Dyspnea. What else?
Absent lung sounds on one side.
They could have lung sounds, right? Their lung sounds, it is possible to be diminished or absent on one side. It is possible. What kind of pain am I going to have?
Chest pain.
Chest pains. A majority of the words they use for that one, they call it pleuritic chest pains, to do with the pleurisy. Okay? So think of that. So think, what other signs and symptoms can I have? Think of my skin.
Oh, cool, pale diaphoretic.
Thank you. CTC, cool pale diaphoretic. You follow me? You got to think of signs and symptoms of shock. Just because you don't feel it's the shock, but you know it's a form of obstructive shock. Can I have anxiety? Yes. Can I have restlessness? Yes. Can I have tachycardia? Yes. Are you following me? Can I be pale, cool diaphoretic? Think of the signs and symptoms of shock, because this is a form of obstructive shock. So you're sometimes you're trying to pinpoint it exactly similar to what you pinpointed with like Beck's triad to do with a cardiac tamponade. But yet, go back to signs and symptoms of shock. Okay? Now, the tension pneumothorax. That is the blank of all the pneumothorax. That is the worst, right? Can you tell me signs and symptoms of a tension?
Tracheal deviation.
Excellent. What else?
Absent lung sounds on the affected side.
That's right. That's where you're definitely going to have that absent or diminished lung sounds on the effective side. That's true. What else? See, you have to think.
Well, they're
Like,
gonna probably have narrowing pulse pressure. I
No.
think. No, that one, because it's part of Beck's triad. I don't know the next one.
Yeah, it's okay. It's all right. Listen, this is why I ask you these things to help you. Subcutaneous emphysema. What is that? That's when the air that they breathe in, it comes out, some of it, and the rest gets trapped underneath the tissue. Think of the sounds of that subcutaneous emphysema. Think of Rice Krispies, snap, crackle, pop when you listen to it with your stethoscope. Okay? If you ever played with bubble wrap, that's how it feels when you touch the top of the skin. Okay? So think of that. Shortness of breath, difficulty breathing, pale, cool, diaphoretic. Go back similar to what you learned in signs and symptoms of shock.
Well,
Okay.
how late will the blood pressure drop? Is that like right before? Like, because I know like transferring into compensated to decompensated shock, it's if it drops below 90, like what?
Excellent, Nick. And that's the 90 you got to go by when it goes into decompensated shock. In the beginning, a lot of these blood pressures with these conditions of obstructions are elevated. Okay. The body's still trying to compensate. But once it goes below 90 systolic, they're in decompensated shock. And that's another shock we're going to talk about. If you're thinking about all the shocks of distributed, you need to know all the distributed shocks of some form of obstruction. You got the C, you got the A, now you got the T. The T is the works of all the pneumothorax. But when it comes to blood pressure, I would go past that 90 or lower for decompensated shock. In the beginning, because all this trachea deviation and JVD, and especially trachea deviation, those are later signs. They're at their worst if you see that. And it's hard to see. You know how I was taught by a doctor to notice that they had trachea deviation? You take your two fingers, you go right here where their trachea is, and you push back. And if you push back and your fingers could go almost to the back of their neck, they have trachea deviation. It's very hard to see it, okay? You have to really feel for it. That's what I was taught by a doctor. So think of the blood pressure lower later on. Since you brought us to that, I'm going to cover the other two shocks you must know. Compensated shock, you need to know that, above 90. Remember pat pods if you don't remember everything else. In the beginning of compensated shock, you always have this: restlessness, anxiety, impending doom. They feel like they're going to die, okay? Tachycardia, pale, cool, diaphoretic, and so forth. You have this a lot in compensated shock. Cyanosis around the lips, okay, or pale lips. These are all signs and symptoms of compensated shock. In other words, if my norm is 124/84, and you taking my blood pressure and it's 98/48, and that's like real low for me, my body's still compensating, okay? When I get below of what Nick said, and some of you also knew this already too, that 90 lower, like 88/48 or whatever it may be, I'm in decompensated. Test questions we always give you. What is the last thing to go? The blood pressure. Low blood pressure will be the answer. Don't put the word cyanosis, because cyanosis, you can see it in compensated and then decompensated when it goes more perfuse, okay, or diffuse throughout the whole body, okay? So know that 90 for decompensated shock thing. That's the way you separate these, because that's how we.
Yeah. Would the blood pressure like drop at like a steady rate, or is it just going to be like, oh
No,
shit?
It's going to go down slowly. Yes. It will not automatically just drop like this. In pediatrics, it does.
Okay.
We have taught you, and they probably taught you, this is 90 systolic. This is us compensating. Then once it goes below, it decompensates. If it's a pediatric, it does this.
Oh yeah, I remember seeing that. Yeah.
Got that? That's the difference. They go into what the word we use, compensating, death. That's in pediatric. But us, we go from the form of compensated shock to decompensated. If you're not sure, do you all remember this mnemonic? I just put pat pods there. Want to make it easy for yourself? Watch this. When you ever get a test question on the state and you're not sure of the shocks, think of a patient compensating or decompensated by using this. 90 systolic or higher with 2 signs or symptoms of inadequate perfusion, use pat pods. And what pat pods stand for? The first one would be pale or pallor. The A would be altered mental status, AMS. The T would be tachycardia. The other P would be pale conjunctiva. O would be orthostatic blood pressure changes. The D would be diaphoresis, and the S would be shock. Okay, so if you can remember that, that will help you a lot when you're doing decompensated and compensated shock. Now, Nick, remember that 90 you used before? Well, watch this. Any patient that has a blood pressure systolic of 90 or below with 2 signs and symptoms of inadequate perfusion, using this pop pad, that's the easiest way you can answer those test questions. So do you understand what pop pads mean?
Can you repeat that?
Excuse me. Pale conjunctiva, altered mental status, tachycardia, pale conjunctiva, orthostatic blood pressure changes, diaphoresis, which means profuse sweating, Okay? And shock. Yes, our experience. Oh, sorry, that's you, John? Hold on, let me try this.
Oh yeah, I'm just like hearing like an echo after you speak, Nuki. I don't know if anyone else is.
Okay, is it my side or your side? Could be someone had something on, because now it went quiet.
Yeah, it just stopped.
Okay.
Yeah,
It's
it's
probably
stopped.
one of us with our volume, baby. That's okay. Hey, Christina, what's up? Make sure you all signed in, please.
I did sign in.
Thank you so much. I appreciate it. You know, want to make sure that everybody gets the credit. Let me make sure the posts are out. Yes, make sure, please. If you need to sign out and then sign back in, feel free. Okay, so we got that to do with compensated shock, decompensated. You got the orthostatic blood pressure changes, that O. Does everyone know what Nuki's talking about when he talks about orthostatic blood pressure changes? Okay. A lot of people forget that and don't understand it. That's when your blood pressure changes when you're lying supine, you're sitting upright, or you're standing up. You will see a change in blood pressures. You may see a patient who's lying supine and you take their blood pressure and it's 110/70, no problem. You sit them upward and then he pass out right in front of you. They had an orthostatic blood pressure change because it went from similar to that, Ian, yes, going to the postural hypotension. Excellent. I like the word you're using. Similar to that they'll pass out because every time the position they're in, you have a different blood pressure, even right now. Okay, sitting and then standing up. You ever bend down to get something or bend over to get something and then you went up too fast and you got real dizzy? You change your blood pressures also, okay? Because you went from a certain position upward. So know that just in case they ask you that test question wise. Now, there's another shock you must know, always test questions. SNAP, SNAP. We're going to ask you test questions on this. SNAP, SNAP, septic, neurogenic, anaphylactic, and psychogenic. You must know all three or four. All these are a form of widespread vasodilation. The state is an easy test question on this. This is one of the state test questions. They'll ask you, all the following is part of distributed shock except. If you remember SNAP, you got all four of widespread vasodilation. If you do not see anything to do with SNAP, that is your answer. So they may throw out cardiogenic shock in there. They may throw out some other shock in there. That's your answer. So SNAP, septic, neurogenic, anaphylactic, psychogenic. Are all of you comfortable with SNAP with the widespread vasodilation? In other words, do you know what septic shock represents, neurogenic shock, anaphylactic shock, and psychogenic shock? If you're all comfortable, we can skip over that. Okay? If there's one of you who are not, this is the time to speak up and we could go over it. If you feel good on that, great.
Let's go over it if you don't mind.
No problem, John. Okay, septic shock. The 5 things I always told you to look out for besides widespread vasodilation. Infection, fever, bacteria, damage or leakage blood vessels. Those 5 things I always see, especially when they give test questions out, septic shock. So think of a person that went into the hospital and they were not feeling well and they wind up feeling like they had maybe a common cold or maybe something else. They thought it was a flu and they really had pneumonia. Okay? So things like that. So think of sepsis, septic shock. Neurogenic shock, what keeps you alive? 3, 4, and 5 in that cervical, right? They wind up being paralyzed. Whatever caused their paralysis, falling off a horse like Superman did, Christopher Reeves, or, got hit by a car, whatever it may be, okay? Neurogenic shock, I want you to think of first the widespread vasodilation, and then damage to the cervical, 3, 4, and 5, and they lose their muscular and vascular tone. They are prone to hypothermia, okay? The male patient would have a priapism, okay? Because all that pooling of that blood Okay, think of that, and you will get into neurogenic shock. So look at how they're asking their test question. So think of what's going on with your patient. The most important ones I always see is 3, 4, and 5 that keeps you alive in the cervical, the vascular and muscle tone, and they're prone to hypothermia. That is neurogenic shock. Anaphylactic shock, really easy. Any form of allergic reaction, and these 5 things I always want you to look at. The first main 3 or 4 that people look at a lot is the angioedema up in the airway. Angioedema, when you hear the stridor sound, you know stridor already. So think of angioedema. Think of the swelling of the upper airway. I want you to look at urticaria, aka hives, that rash throughout the whole body. Okay, they may use the word diffuse. Okay, so look at that rash, that urticaria, the hives. Then they get into the wheezing sound, lower airway. Think of the wheezing caused by constricting, inflammation, and possible mucus of the bronchiole. Okay, make sure you know that. So you have those 3. And then the last one that we use, okay, is that blood pressure starts going down. They become what we call hypotensive. Okay, they're going into anaphylactic shock. So can you separate some of these besides other things you may see, swelling throughout the whole body or different parts of the body? The answer is yes. They may use the hives of the urticaria and so forth. If you see those that I just described, they are going into true anaphylactic shock. Okay? Remember, any of us can have an allergic reaction to do with anything, no matter what it is, right? So you know anaphylactic. What is the main drug of choice besides oxygen?
Epinephrine.
Epinephrine. And you better know epi. They're going to tell you, they're going to ask you questions and the dosage and so forth and how you administer it. And
0.3 ml, right?
That's right. mg, 0.3 milligrams.
Okay.
Remember, ml and cc's are the same, but not milligrams. Okay, let's keep it 0.3 milligrams for the adult, 0.15 for the pediatric. Now, last but not least is what? Psychogenic shock. I go like this and I go, boo, and I scare Maria or I scare Stephanie, and they go, oh, and they pass out on me, both of them, right? They have a form of what we call psychogenic shock. They fainted, they pass out, they syncopize, okay? Best thing for them is oxygen and so forth, okay? Psychogenic shock, SNAP. All these are what? Widespread vasodilation. So we covered a lot of the shocks. We covered decompensated, compensated. We forgot to include irreversible shock, right? Irreversible shock, think of what? Not even a blood transfusion is going to help this patient. They're going to die. They're out of luck. Yeah, they're you know the letters we want to use here, but, you know, it's being recorded, but they're crap. You know, they're going down. They're going to die, okay? Other shocks I love to make sure you know, just in case. If a person's blood sugar is very low, hypoglycemic, they could go into a form of insulin shock. Okay, it's not in your book. This was in other books years ago. Okay, but if you know these terms, you know, in case you see a state test question, you could answer them easier. Okay, the state loves to repeat their questions. Okay, just make sure you know that. So we got a bunch of shocks. Is there any shock we did not cover? Ian and all of you who are putting these beautiful mnemonics up there for me, I couldn't type it as fast as you all could do that. That is awesome. Thank you so much. So we got obstructive shock, we got distributed shock, we have hypovolemic shock, hemorrhagic shock, insulin shock, irreversible shock. Did we miss anything? Besides, cardiogenic shock. What's cardiogenic shock? They always give that. What must have happened? Okay.
The heart muscle itself has to be damaged.
That's right. It's the heart muscle itself, especially on the left ventricle area, right? they are prone to acute pulmonary edema, okay, fluid in the lungs. They had a heart attack. They have had to have a heart attack in order for them to go into cardiogenic shock. Okay, so the heart attack occurred. After the heart attack occurred, within possible 24 hours, they could go into cardiogenic shock. Okay, beautiful. You are all awesome. Okay, this happens to you that if you have, tell me this word. It's to do with my arteries, and it has fat, lipids, cholesterol, plaque, calcium deposits.
Atherosclerosis.
That's right. Okay, that's the AT, right? Remember to put the F there. If it spells fat, the first three letters, right? The atherosclerosis, you know, it's to do with plaque, fat, lipids, calcium deposits, right? You need to know that. Cholesterol. If it says the word fart, when you put the F in there, the first four letters, because there's another word with the ART. Remember, that's the thickening and hardening of that lumen, of that artery. You need to know that. Separate those two words. We love to give you test questions like that. So, you know, mostly that happens at people at a certain age. Could it be like 60 and older? Yes. Could it be younger? Yes. There have been people, patients, younger, that are in nursing homes. I don't know if you know that. Okay. Because they have some form of disease or something from 30-something years old to 40-something years old, and they live in nursing homes. Okay. So no, these things could occur. So are you all comfortable with a heart attack, a stroke, cardiogenic shock, CHF? If you're not sure what I just mentioned, we could go over that. If I say another word for heart attack, what will you tell me? Give me the three letters. Right? Acute myocardial infarction, right? That's death from that heart tissue, that heart attack. What is angina pectoris? Is that a heart attack? Okay, chest pain to do with what? Give me more than
Spasms of
chest
the
pain.
intercostal muscle,
Say that again, Jason.
tightening and spasms in the intercostal muscles and
You can have
interstitial.
that. And why do you have the spasms there? Why do you have that in chest pains? Lack of what?
Potassium,
Besides potassium, you're getting really into it.
calcium,
Yeah, I don't want you to get into potassium and
electrolytes,
we'll
water.
be talking about the potassium and sodium pump. I want you to take it down a notch, but that's good. You're right there too. Excellent on that. But I want you to think of like some form of ischemia, lack of what's occurring besides the
flow?
chest pain.
Circulation.
Blood flow. There you go. Blood flow, oxygenation through there, right? That oxygenation, right? John, what is the AED shock?
Oh,
Is that
it's,
something funny? What? What is the AED shock? Put it. I mean, it's only us.
sorry.
What
No,
is
when you
the-
mentioned that we're
He's-
missing one more shock. I
He's
just
making
had-
an electricity joke.
I'm totally lost. That went right over my head. My wife saying behind me, "See, that went right over your head, honey."
That happens to me a lot. I tell pretty lame jokes.
Oh God, you guys are too much, and ladies, too much. Are we comfortable with a stroke? Okay, if we are, you know, there's two types: hemorrhagic and ischemic. Know both of them. Okay, know the signs and symptoms. If there's anyone here confused with the signs and symptoms of a stroke, okay, is there anyone here know what is the Cincinnati stroke scale? Okay, so you're all comfortable with that. It's kind of easy. Okay, good. Okay, name in order from ascending. No, well, make it easier. Superior to inferior. Name in order the 5 section of your vertebrates. In order. Okay, give me the numbers. What means?
5, 5.
554, 554. Of those, which of those sections are fused together? That's right. Out of those 5 sections, which 2 sections are susceptible to injury most of the time? Always get injured. Cervical is one of them, and the other one is what? It's lumbar. It's always a state and could be a class question. So you need to know everything about these. How many vertebrae you have, 33, and so forth. You need to know about the brain. They're going to ask you do brain again. You need to know, if I say CNS, what does that mean, CNS? Central nervous system. Consists of what? What does the central nervous system consist of? There's 2 main things.
Brain and spinal column.
Thank you, Jason. The brain and spinal column. You need to know that. Okay, that brain and spinal column or the spinal cord. They're going to ask you that. You need to know that. So, very important that you know all that. If I say, name the 3 parts of the brain, the 3 parts of the brain, the main ones. Okay, out of those 3, which controls the vital functions of life? Good. Which controls balance? Coordination.
Cerebellum.
Thank you. Cerebellum for cerebalance. Remember that? Maria, right? Cerebellum, cerebellum. Cerebrum,
Yes,
which is
sir.
everything else. That's the easiest way to remember when you like, is it cerebrum or cerebellum? Cerebellum, cerebalance. You know? Okay. Good. That's how they're going to ask you. So you need to know when we get to neurological to do with the brain. You know, the right controls the left controls the right, and so forth, especially in stroke victims and so forth, if they ask you that. Okay? Are we comfortable with the abdominal cavity or abdominal pelvic cavity? In other words, do you know all 4 quads comfortably? All the organs in each one and all the conditions? Yes? This is the time to ask. If you all comfortable, that's great, because they're going to ask you the quads. Right upper quad, left upper quad, right lower quad, left lower quad, and so forth. Know all conditions that could occur there, okay, that we spoke about earlier. Remember, cholecystitis, pancreatitis, appendicitis, diverticulitis, okay?
Nuki, can we just go over in the quadrants, right? Like, let's say a patient had left shoulder pain, right? It would be injury to the stomach, like the spleen, maybe?
Some people will use the spleen or the pancreas. A lot of us feel comfortable when we get to like pancreatitis using that. They would say like left upper quad and a left shoulder pain, and they use the pancreatitis. If they say the right side, they go with the right upper quad, and then they say the right shoulder. And what gives that test question away always, especially on the state, is after they have ate fatty foods or spicy foods.
Gallbladder, right?
That's right. Gallbladder, which will be cholecystitis. If it's the right lower quad, they're going to give you signs and symptoms that the patient feels a pain right there, very severe right lower quad pain. And they use the words like referred pain, not radiating, referred. Know those 2 word separation. And then they got their navel area, like the umbilical area. They say it's a referred pain there. You think of appendicitis. And then when it comes to the last one, diverticulitis, the left lower quad, okay? And then that referred pain is possibly both upper quads. And then that would be your diverticulitis. Now, a lot of you may remember, are there other organs in those locations, male and female, especially the female, that could show other or similar signs and symptoms? You need to know about those too. When I'm talking about ectopic pregnancy, STDs, PID, public inflammatory disease, just in case. Did I say pelvic? No? Did I, my love? maybe I said it wrong, but PID. So you need to know this just in case. John, are all of you comfortable with those conditions, even if they ask you about ulcers or UTIs or anything like that?
I mean, it couldn't hurt to just do one more time.
Okay, which one?
Well, those conditions, right? Like maybe if we can just correlate, like if you give us an example like of a condition, then we can choose like which quadrant. Maybe
Okay. Okay, if I give you this, pain right lower quad, blood, hemorrhaging slightly, they have a gait walk. This is the female. What's the first thing that comes to mind? And don't tell me don't tell me appendicitis. What other condition could it be for the female that she is going through right now? Blood, okay, on the underwear, let's say, okay. She has a gait walk.
Tubal pregnancy,
Say that again.
tubal pregnancy or topical
Yeah, ectopic
pregnancy.
pregnancy. That's it. That gait walk gives it away. GAIT. It's like a shuffling of the feet when they walk. Okay. So if you notice, you need to know signs and symptoms. When you have read or gone to OBGYN and so forth, you're going to get into PID, pelvic inflammatory disease, and STDs and things like that. But I just want to make sure you're comfortable with all the quads right now to do with solid organs, hollow organs, and conditions to do with the itis part. The other ones we could go over when we get to that section. Are you okay on that, John?
yes, I am.
Do you know all your solid and hollow organs, all of you? Abdominal cavity. Yes, no, okay, okay, pal, slugs. Okay, good. Because we're definitely going to ask you all your quads. You better know your quads. Are you comfortable how you take a blood pressure?
Yes.
Okay. If you don't forget, how many millimeters of mercury that you should be when you stop hearing any longer, you're supposed to squeeze it a certain number higher, millimeters of mercury. Do you remember?
20 higher than you stop hearing.
Yeah. It's 20 to 30. Yes, it is. That's right. Then you don't hear it no more, period. And then when you turn your little knob on, turn it a little bit to the side, and you let the numbers go down, that first sound you hear is your systolic, and the last one is called your diastolic. If they ever ask you test questions to do with vital signs, state-wise, it may be the Kudakov sounds, but I have yet to see that in years. Kudakov sounds are all the different phases that you have. There's 1 to 5 phases of how you listen to the sounds when you're taking a blood pressure. Otherwise than that, you should be good on that. Lifting and moving. Lifting and moving. How do I lift up a patient? How should my body be? Okay, I see Kenny with his hand or palms up. That's the palm grip, right? Like a squatted position, using only your legs, right? And your arms, which is your extremities. How should my back be, my body?
Back straight.
Is back straight?
It's the
Straight
bigger,
back.
so therefore stronger muscle.
Say that again, Devin?
I said it's the bigger, therefore stronger muscle. I'm joking.
But it's true when you come to stronger muscle. If you have a weak muscle, like one of your legs are weak, they say that you have that a little forward, that leg, very slightly when you're going to squat down. But you have to be straight up vertical. Lift with your what? With your extremities. Okay? You follow commands. What is the average EMT weight you must be able to pick up? That's right. 125 each one. So me and let's say Kenny are going to pick up the patient. The average patient would be 250 or less, requires only 2 EMTs. Okay? If it's more than that, 300, 400, how many EMTs we want? Always a test question. It's 4. That's how they get you. Okay, I'm carrying this patient on a longboard. There's 4 of us. There's one in the front, one in the back, one on each side. What is that called?
Diamond carry.
Carry.
Diamond. Okay. That's right. Diamond carry. They
I don't
always,
have any sodas.
okay. I pick up the patient by underneath their underarms pit, and I grab the opposite arms and underneath the legs. What is that called? Extremity carry. Extremity carry. So what I say, it's okay, lift, but we're going to the same place, right? You're taking a patient. What is the best movement to take your patient from their bed to your stretcher? Well, it's like a blanket carry, but what is it called? Give me the
Draw
correct
sheet
word.
method.
Draw sheet. Thank you, Jason. Draw sheet method, right? So they may ask you this, you need to know. What is this device that utilized in like rough terrain or a mountain or cliff that you need to get this patient down from there?
Basket stretcher.
Basket stretcher, also known as what? This is a state test question.
Stokes.
Stokes.
I believe.
That's right. Stokes. Stokes. You need to know that. The Stokes.
They use it for helicopter lifts too.
That's right. Exactly. Okay. So excellent, excellent, excellent. So let's see what else. We got that. Got that. You're good on that. Okay, when you have a patient who needs to be rescued, let's say in a pool, a lake, I don't know, what is the best device in order to get that patient out of there?
Line board.
Longboard. Excellent. Why the longboard, Jason?
It floats and they might be paralyzed or have spinal damage.
That's right. You look at that. The longboard is a flotation device. Okay. So you're supposed to get that patient out of there. If they ask you different techniques, especially the state, you can use their arms side to side. Okay. If they're prone, you can still use their arms and turn them around as a unit, or some of you people use their mandible and their occipital region and turn them as a unit also. Okay. But mostly what I've seen a lot in the state is using their own arms. Okay. When a patient is in water that you need to take them out. Okay. Think of that flotation device. Think of that spinal immobilization device, that longboard, especially if you need to do CPR. It's a nice, flat, firm surface that could be utilized also. Okay. What do I mean by general adaptation syndrome? General adaptation syndrome. Do you remember that? This is going way back now. Do you remember the fight and flight? Right? When they give you the word to general adaptation syndrome, that's your form of body to respond. Okay? Now, you notice they have what we call that fight and flight is included in there. I want you to remember these 3 letters, A, R, E. If they give you a test question to do with general adaptation syndrome, ARE represents alert. And then the R's, there's 3 there. They talk about reaction, resistance, and recovery, and then exhaustion. Okay, that's what they want you to know how a person is going to respond. So remember the word general adaptation syndrome, and then the other 3 letters that fall under that, ARE. Okay, alert, resistance, reaction, recovery. Okay, and then exhaustion, because they'll give you a test question like that. You need to know that. There's another 3 letters I need you to know. What do I mean when I say GCS?
Glasgow Coma Scale.
That's right.
Drinks you owe me a soda this time, Kenneth.
Yeah.
Exactly.
Yeah, Glasgow Coma scale. Okay. What is the highest number you could get on the Glasgow Coma scale?
15.
15. What is the lowest?
8
3.
or
Right?
like 3. Yeah.
Three it is. Now, the thing is here, we have to remember the letters there also. What does that represent? The eyes, verbal response, and motor response. So eyes, verbal response, and motor response. Okay, if they ask you anything to do with that, make sure you know that just in case. All right. When I use certain devices like to take your blood pressure, I use 2 different types of methods to take your blood pressure. What are the 2?
Palp and auscultation.
One by auscultation and one by palpation, right? One with the stethoscope, one without it. Excellent. Okay. What does the top number represent? Blood pressure wise.
Systolic.
And what do I mean by systolic? What do you mean?
The force of the blood vessels, like pushing the blood against the blood vessels of the heart.
Okay, John, give me one word that covers all that.
Contracting.
Contraction.
Contraction. Yeah.
Yeah, because he is right. A lot of you get into detail, which is awesome, but simple, they ask you contracting of the ventricles. Okay, especially that left one. That's what you need to know with the systolic. So if I give you 130 over 70, you know 130 represents contracting. If I give you the diastolic and I give you the 70, you know it's diastolic. Diastolic represents it resting, relaxing. You need to know those words in case they ask you to do with blood pressures. Now, you already got it by auscultation. Palpation is like 130 over P. Okay, you did it because you were in a train station. It's too much noise there. So you did it by palpation. And you only get a systolic. You don't need no stethoscope for that. Okay, good. Now, what's another toy piece of equipment device that we can utilize? Checks the patient oxygen saturation of the hemoglobin.
The pulse ox?
The pulse ox, excellent. Now, when you get a pulse ox, how would you get forced readings? Force numbers. What can give you force numbers?
Carbon monoxide poisoning.
That's 5. That's one of them. Excellent, Devin. So you got one of them. There's 4 more.
Dark nail polish.
Nail polish?
Dark nail polish, red, purple, black, right? That's 2 of them. Give me another one. Anemia. Excellent. That's 3. What else? 2 more. People always forget.
Is it the color of the person's skin?
Hypothermia.
Hypothermia. Thank you, Jason. Hypothermia. And another one that starts with the letter H. Hypovolemic shock. Okay? Those are the 5 they always talk about. Know that in case they give you. When the numbers we always want to see is what to what. Blank to blank. That's 94 to 99. So you need to know that. Make sure you understand that. If they ask you, what does the pulse ox do? You know it measures the oxygen saturation of the hemoglobin. Very important, okay? If I have a lack of oxygen, I could become hypoxic, or I have a form of hypoxia. What do I mean by hypoxia? Okay, so tell me some signs you'll see. What will you see?
Cyanosis.
It's just possible to see cyanosis. What else?
Altered mental status.
A form of altered mental status. What else? What else?
Labored breathing, possibly in
Excellent.
tripod position.
Oh, I like that. Now we're getting into a little bit of that. Tripod position, labor breathing. They could be breathing fast. What else besides breathing fast? How about a pulse, slow, fast?
Fast.
It is fast. It's tachycardic. Okay, so I want you to get into signs and symptoms also of hypoxia. I want you to get into the early signs and symptoms of it and the later signs in case they ask you that. Okay, when you get into later signs of that, where you see like profuse cyanosis and things like that? The answer is yes. But the early signs, you need to know the early signs of it also, besides, other signs. Okay, make sure you know that just in case they ask you. Give me a good way to open up the airway in medical. How will you open up the airway in medical?
Head tilt chin lift.
Okay, so you're looking at things like in patient assessment, right? Head tilt chin lift, medical, trauma,
Jaw
Jaw
thrust.
thrust.
jaw thrust, right? When you're going to put an airway adjunct in there, what kind of technique do you use in order to open up that airway? Starts with the letter C.
If you scoop the stuff out, scoop the debris out.
Say that again, Parmish.
Do you scoop the stuff out you see? You can like visibly see.
You sound
Cross finger.
Cross finger.
cross finger technique. That's what we use a lot to open it. You use it when you put that airway adjunct in there. Okay, there's two ways of putting an airway adjunct in there. Name the two. I'm talking degrees.
One's 360. One's 180.
180 and 90 degrees, right? Measurements of that device. How do you measure an OPA?
Ear to mouth.
Corner of the mouth to the earlobe, or the center to the angle of the jaw. That's the way you should have been taught, if anything, if they're still teaching it that way. How about the NPA? Tip of the nose, New York State, to the earlobe. That's New York State. National Registry, they won't even use the tip of the nose. They'll use the septum to the earlobe. That's National Registry. Okay? So make sure you know that. New York State, I always seen tip of the nose to the earlobe. In the NPA, it must be blank before it's inserted.
Lubed.
Lubricated.
Lubricated, water-soluble solution. Don't forget the bevel always faces the septum going into the right nostril first. Okay? Need to know this. Would you use a NPA for severe facial injury? No, they tell you not to. Are you all comfortable with OPQRSTI, decap BTLS, sample, ICE, APU? You're saying there's so many damn mnemonics here. Yes, but they help you. ABCD, okay? OCMNs, open, clear, maintain, sounds. OI pass or I passo, VCRs. If I'm mentioning all these, they represent different sections of your patient assessment. Are you comfortable with them all? Yeah? Okay, good. You better know that OPQRSTI and that decap BTLS. You definitely need to know your patient assessment, medical, and trauma. How about NOI and MOI? Okay. How about index of suspicion? Okay. You are awesome. Okay, you have, and you need to know this. We're going to get into a little more of the devices and conditions. Can anyone here tell me what does COPD represent?
Chronic obstructive pulmonary disorder.
Okay, chronic obstructive pulmonary disease, right? My question is, there's two of them, right? You got your emphysema and you got your chronic bronchitis. You need to know both of those in case they ask you questions. Are you comfortable with your CHF, which is congested heart failure, left side and right-sided heart failure? You need to know the signs and symptoms. Any questions on that?
Nuki, could we just go over that?
Which one?
The congested
CHF?
failure?
The CHF, the left side and the right side?
Yes.
Okay. If they ask you CHF, you have to remember that a patient had a heart attack. Okay, it could be prior, it could be a while back. It got worse because a lot of CHF comes up with time after a heart attack. not like cardiogenic shock, which can happen within like 24 hours. Let's say days later, this wakes them up or him or her up from them sleeping. They can't sleep correctly and they got signs and symptoms of CHF now. The difference is left side, LL, left side, lungs. Think CHF, left side, lungs, left-sided heart failure. The LL, left side lungs, represents fluid in the lungs. Okay? Fluid in the lungs, which you know it as pulmonary edema. In the left side of the lungs, when they have fluid in the lungs, they also will have what we call, and they cough up a pink, frothy sputum. Look for that. That's the left side. Left side lungs, LL. RR, right side of the lungs, rest of the body. Right side of the lung, rest of the body. Look for this. JVD, jugular vein distension. Okay? Go further down, and now it is possible that the patient can have that fluid in abdominal cavity known as ascites. ASICTES. ASCITES, excuse me. ASCITES, ascites. I want you to think of that like an overinflated basketball. Okay, very hard, very rigid. Okay? Look down in the lower extremities. They have their feet, their ankles, okay, their legs area, the lower extremities, with a lot of fluid there retaining, called dependent oppidal edema. You need to know that. A test that we use out in the field to see how much is being retained there is called a pitting test, Pitting. We take the finger and we squeeze the leg, their foot or the ankle like this. And if it stays indented, depending how long, +1, +2, +3, +4, the higher the number, the worse it is, okay? Because it should not be staying indented, okay? So that's called dependent oppidal edema. Know those words. That's the right side of the heart. So you have left side and right side, you combine them together, you got congested heart failure, okay? They will ask you questions on the left or right side to do with signs and symptoms. So I want to make sure you're comfortable with CHF. That's congested heart failure. Look at what's occurring here. These people, and I think one of you put a word up here earlier to do with the positioning of the how they can lay down. Okay, there's another one called PND. I'm brain farting here. Penny, PMD again. Thank you. Thank you. Know that just in case they may ask you that. The positioning of the pain. Thank you, Ian. Ian, I don't know how you could type that fast. God bless you. I'm a one finger man. Now he types so damn fast. I don't know how you guys and ladies do this. My kids do that. My son could do like 200 something words a minute, easy on, on a computer or typewriter. I'm like, whoa, I can't. But that's good. So, John, are you comfortable with the CHF now?
I am now. I appreciate it, Nuki.
Yeah, because that's where you see signs and symptoms. Look for that. Okay. So COPD, we have CHF. We went over asthma. If you want to go over asthma, I'll just state it real quick. Look for constriction, inflammation, and possible mucus in the bronchioles. Okay, asthma. Look for the sound or the hearing sound you see. It's wheezing upon exhalation, if they ask you that. We went over BVMs, pocket face masks, nasal cannulas, non-rebreathers, okay? CPAP. CPAP, if they ask you, it forces the air down to keep the alveoli open. Look for that word force. That's where I see test questions a lot. So it pushes everything out the way, CPAP, okay? Types of patient they usually use CPAP for is acute pulmonary edema, in case they ask you that. Are we comfortable with devices, if I say nebulizer, what do I mean by nebulizer? What is a nebulizer?
Isn't that used for asthma patients?
It's used for asthma patients. What type of medication we use for these asthma patients? Albuterol sulfate. Excellent. You know, they may ask you that. Make sure you know, is that albuterol? Okay, albuterol. They ask you, you know that. Are we comfortable with the numbers of a nasal cannula, non-rebreather, BVM, and so forth? How much it tries to give? The percentage? Is there any questions on any of those devices? No? Excellent. Are we comfortable with all the shocks? Compensated shock, decompensated shock, irreversible shock, obstructed shock, CAT, cardiac tamponade, acute pulmonary embolism, tension pneumothorax, obstructed, SNAP, widespread vasodilation, which is distributed shock, hemorrhagic shock, hypovolemic shock. Oh, beautiful. We covered a lot on that. That's excellent. So if they ask you anything to do with test questions on that, you know how to answer it because you need to know all your shocks. Are we comfortable with CPR? Any questions on CPR? Any ratio of compressions to ventilations? The ratios of the numbers of compressions on anybody should be 100 to 120. Positionings, anything like that, you need to know that. Hand placement, center or the lower half of the sternum, things like that is how we like to ask you test questions. Okay, hold on for some minute. I'm getting all blurry here. Okay, there you go. There's something I see me like a total shadow there. Are we comfortable on your AED? Any questions on your AED? No pulse, no breathe.
Nuki, in terms of CPR, can you just go over if someone's in cardiac arrest inside an ambulance and the ambulance is in motion, there's not going to be an AED shock, right? Because you don't use an AED because it'll confuse it with the motion of the ambulance and the reading, right? It'll disrupt.
Yes, you could probably get some form of artifact, but they want you to always do, and this is always a test question. I'm glad you brought that up. You have to stop the ambulance, of course, pull it over to the side, stop the ambulance, and then do what you have to do with the AED. Okay? That's always a test question. Okay? The first thing you do is always CPR on a patient, and then you try to get the AED as quick as possible applied to the patient. You always see that as test questions also. But yes, please make sure you stop. Okay, we know the child, we know the infant, we know the adult, we know the AED. What two rhythms that the AED recognize? Always a test question. VTAC, VFib, right? Excellent. We know about stopping the ambulance and so forth. What is the difference between respiratory arrest and cardiac arrest?
Not breathing and then not having a pulse.
Okay, yes. I want you to know that if a person has a pulse, it could be weak, but the breathing is absent or inadequate, you're doing a form of rescue breathing. That is a patient in respiratory arrest. If they have no pulse and no breathing, of course, that is cardiac arrest, right? Make sure you know the difference. They love to ask you test questions on that. Is there any questions on potential energy, kinetic energy, work, and stop? You need to know all of those. If I say potential energy, what do I mean by potential energy?
Mass times gravity times height.
Okay. How about kinetic energy?
Does anyone else want to answer it? Because I know all these off the.
Isn't that just force of concept?
All right, 1/2 mv squared is kinetic energy.
Okay. So can we say that it's associated a lot also to do with the speed of it?
Yes.
Good. How about work?
Work is the force over a distance.
Excellent. Look for that word, distance. That's how they get you. Then everything has to come to a stop. Okay? So no potential, kinetic, work, stop in that order. That's how I see them always giving test questions. Okay? If you could break down each of those, you'll be okay. The next thing is if I ask you to do with collisions, they love to ask you the difference between the first, second, and third collision. Anyone confused with the first, second, and third? Okay, if you are, this is the time to ask. If I say first collision, what you're thinking automatically?
Is the first collision like the impact wave hitting you, or is it the intestines hitting the inside of your body?
Okay, no, that's the other one. Thank you for bringing that up. So let's say the car hit the building, right? That is your first collision. The second collision is your body inside of the car hitting. And then the third collision will be the internal organs inside the body. You need to know all three. First, second, and third collision, okay? I'm glad the way you brought that up because some people forget. And when they ask you about the third or the second or the first collision, people get that confused. And you need to know all of them.
And also the coup counter coup, right, Nuki?
Yes, if they ask you coup counter coup, they always love to associate that with the brain. Can technically you could say that coup counter coup can happen to different parts of the body organs? The answer is yes. The thing is, we always associate a lot with the windshield hitting the glass windshield, the head hitting the windshield, the coup counter coup there. We want to make sure you know that. We want to also ask you questions on whiplash, or we ask you to do with different frontal collision, frontal impact, T-bone, lateral, whatever. We want you to know more or less what could be injured. What they're definitely going to ask you also, and you need to know this, what is the difference between primary, secondary, and I think it's tertiary? I always say that word wrong.
Tertiary.
Thank you, Devin. Thank you. Tertiary. Kenny, you were supposed to correct me. Devin, thank you. Tertiary. Did I say it right? Tertiary?
Tertiary.
Tertiary. You see, I always say it wrong. Thank you, Devin. Okay, tertiary.
Yeah, you kind of pretend there's a U there.
Okay, tertiary.
Yeah,
There you go.
tertiary.
Are we comfortable with all three? Yes? Beautiful. So if they ask you a question to do with the primary, think of the hollow organs. If they ask you to do with the second one, think of the debris. And if they ask you to do with the third one, I want you to think of the patient hitting an object that they were thrown to do with that explosion, let's say. That's how they get you on test questions. Make sure you know that. Okay? Are we comfortable with this? Is when we're going to get into a lot of bleeding stuff. Okay? We went over words like hemothesis, hematemesis, melena, and so forth. If I say, give me another word for a bleeding nose.
Epistaxis.
Okay? What is your main way of treating this patient? Okay, I see Kenny squeezing his bridge of his nose, which is correct. And how would this patient be positioned? Backward or forward? Forward, right?
Forward.
Why? Well, besides that, they lean forward to allow for drainage. That's always the answer you'll see. It allows for drainage. Never back because they can aspirate, vomit, and so forth. We don't want that. So you need to know that. Are we comfortable with all the soft tissue injuries? What I mean by abrasions, avulsions, amputations, lacerations, incisions, okay? Words like that. Ecchymosis, contusions, hematomas. This is the time to ask if you're not. up to date on that. If you feel comfortable, that takes care of a lot of things I have to review with you. Because if they ask you anything to do with that, I need to know to make sure you understand that. Are we comfortable with direct pressure, DPT? Direct pressure, pressure bandage, tourniquet. Are we comfortable with the word tourniquet? You know, how many inches is supposed to be away, more or less? You know, if you got multiple lacerations, can you go high and tight? Don't forget you have to put the date and time, things like that. You need to know this. As long as you're comfortable, that's cool. Are we comfortable with all burn victims in the sense of any burn questions you may have, or to do with, let's say, sprains and strains or fractures? Okay, you need to know that they're going to ask you things on that. I need to make sure you're comfortable.
Nuki, can you just go over the main differences between sprains and strains one more time?
Okay, the easiest way, BMT, bone, muscle, tendon, BMT, and then put the word strain right next to it. Bone, muscle, tendon, how is attached, bone to muscle by tendons. If something goes wrong, it could become a strain, like the BMT, the train station. So you put the word train and put an S in front of it, and you got strain. If it's BBL, bone to bone by ligaments, right? That's a sprain. Okay, they ask you that, just you need to know the separation. If they ask you a fracture, remember the main thing there is the lack of that continuity of the bone. The bone is broken somehow, whatever the fracture it may be. You need to know how to take care of all the fractures. Remember this, these words they love to ask you. You must first stabilize before you immobilize. And if you are immobilizing a fracture, depending what type it is, it must be immobilized above and below the fracture site and the two adjacent joints. And don't forget, you always check post-motor sensory in the beginning and post-motor sensory at the end. Okay, these are always test questions. If it's a fracture, you always try to immobilize that fracture in the position of function. If the state asks you this also, you have one attempt to put that grotesque or grossly deformed fracture in the position of function. If you cannot, then you immobilize it in position found. Because what you're really looking for, if you have a fracture, let's say this is all discombobulated, right? And you don't feel a pulse, we're telling you, according to New York State, you're allowed one attempt to strain it out, okay? If you feel resistance and you can't, then you have to put it in and splinter the position of function, position found that way. But remember what I stated there. So one attempt, you or your partner. That don't mean one attempt you, then one attempt me and Kenny, or one attempt me and Maria. She goes and I go. No, it's one attempt. Okay, these are always test questions. I want to make sure you know that. So that should help you on fractures. If they ask you, how do you treat, let's say, an ankle fracture, they use this word a lot. And if I remember correctly, I think it was called RICE, RICES. Thank you. There you remember that. Excellent. Are we comfortable with the fractures? Are you comfortable with femur fractures? Pelvic fractures? Okay, because if we ask you a test question on that, you need to know the devices. If I say an foot or an ankle and it's possible sprain or fractured, what is the main device you use on that they always talk about? and it starts with the letter P.
Yeah, pillow, right?
Pillow. They say, yeah, pillow splint. They actually use that. You know, if they talk about other fractures, just think of what you learned in class. The short or rigid boards, or the medium size, or the real long ones. Okay. And if they talk about the femur, remember the two devices they love to teach you in class: the hair traction splint and the Sega traction splint. Both are utilized for mid-shaft femur fractures, in case they ask you that. Are we comfortable with eviscerations? How to take care of it? Okay, beautiful. Okay, test question. Okay, John, if you're not, it's just in case we could go over it. It's moist sterile dressing first, with the occlusive dressing over that, and then bulky over that. Okay, that's what they will ask you. There was 3 locations where you put an occlusive dressing of some form of type. Give me the 3.
Neck,
Yes.
chest, and abdomen.
All multiple choice for your midterm. It's going to probably be 100 questions. Say that again. Someone just stated something. I'm so sorry.
Neck, chest, and abdomen.
That's right. Neck, chest, and abdomen. Excellent. The next question would be to prevent a pulmonary or air embolism. That's going to be the test question answer. I always see that in class or in the state. Okay, make sure you know that. And the rest you know. And don't forget the flutter valve in that chest one. That's very important. There's 2 main functions of that flutter valve. Can anyone tell me? What is that occlusive dressing with the flutter valve represent? There's 2 main functions. That's right. So that occlusive dressing prevents air from going in, and really technically, if it needs to go out, you lift up that flutter valve. Excellent. Are we comfortable with the rule of 9s? The rule of 9s will be on your exam. I'm telling you this right now. On your exam and on the state, the guy definitely asks you the rule of 9s. Okay, everybody comfortable with that? Are we comfortable with words like irrigation or the 20-20 rule? Do you remember when I spoke about the 20-20 rule? What do I mean? Yes, they're both 20 minutes of irrigation, Kenny, but one is for the eyes and the other one's for the skin. Remember that? The skin, if there's any form of like powder on the skin or on top of their clothing or uniform, whatever it may be, you brush it off first and then you irrigate it for 20 minutes. Which one that I taught you all that you do not mix with water? There's 2 names I gave you. That they will ignite if you mix it with water. It's called elemental sodium and phosphorus. That was in the old book of JB. I don't know why they took it out. I don't remember seeing it in this one, or maybe I missed it. Okay, if I missed it, someone correct me, please. If you found it under Burns and so forth. Okay, phosphorus was one of them, and the other one was the elemental sodium. They say don't mix it with water because it will ignite. Okay, we went over that. We went over occlusive dressings. Okay, let's go over a little thing here to do with more trauma. If you have a skull fracture, give me the different types of skull fractures. I know we didn't really get to take a break here. I'm sorry, but I think we're going to be finished early. So I'll just continue and then I'll upload this and send it to you because I know you got you guys' exam tomorrow, right?
Yes.
You guys all, you ladies and gentlemen all have this, you know. Give me the different types of skull fractures.
Basilar.
Basilar is one of them. Give me another
Was
skull.
one like linear?
Linear, yes. Give me another one. Compound, explained.
I think it was caved. right?
Like depress,
Depressed. There you go.
depress,
Yeah.
skull fracture. Okay. And there's another one. You see all the brains. The open skull fracture. Okay. So you need to know these. If I tell you, I describe this, you tell me what it is. Black and blue ecchymosis around the eyes. Behind the ear, vital signs. You need to know these words, okay? What is this? Ready? My blood pressure is really, really high, and my pulse rate is bradycardic, and my respirations could be erratic. It could be like up or down. What do I have?
Cushing's triad.
Cushing's triad, and a form of what else, Nick?
Increased intracranial pressure.
That's right. Always a stating class questions. You better know ICP. Okay. ICP. You better know Cushing's triad, aka Cushing's reflex. Okay. Make sure you know that because they always love to ask you that. Know the signs and symptoms of that. If you're confused, just think of the opposite of shock. This is always on a state test question in class. If you know shock, like a person going into like decompensated shock, think of the blood pressure low and the pulse rate high. This is shock, right? Decompensated, let's say. Now watch the ICP. It changes. So it's the opposite. Blood pressure very elevated, pulse rate very decreased, bradycardic. Here goes decompensated shock. That's the easiest way. In the state, they used to ask you with arrows or words about ICP. What is one of the most reliable ways that you could tell that you could see a sign to do with a head injury? What would be a reliable way that you know something's wrong here?
AMS.
AMS, the level of consciousness. Yes, the AMS, not their pupils. Don't go with pupils. People think it's always the unequal pupils. No. Okay, because unequal pupils could be medical or trauma. Medical, you're thinking of a stroke. Head injury, you're thinking of trauma. Okay, so don't rely about unequal pupils. People always get those confused. Anyone confused with the word subcutaneous emphysema, tension pneumothorax, hemothorax, hemopneumothorax, spontaneous pneumothorax, flailed chest, broken ribs, commotio cordis, pulmonary contusion, cardiac contusion. No? Okay. So better know these. Okay. Everything I just mentioned, you better know. If you're comfortable with it, we can continue going on. We went over all the quads, all the different problems to do with diverticulitis, pancreatitis, appendicitis, cholecystitis. What is that other word that they tell you when you have some kind of leakage around that area of your abdominal cavity? It causes this. What am I trying to say without saying the peritonitis? Okay, so there's going to be a lot of itis there. Make sure you know all those. Okay, are we comfortable with words like hematoma, hematesis, hematuria, hematemesis, hypovolemic shock, hemorrhagic shock, hypoxia? You notice I'm throwing a lot of H's out, right?
Has to do with blood.
Okay. Yes. So if I say you got blood in your urine, what do I mean, John?
It would be hematuria.
That's right. You know, so what kind of injury you think occurred that you got blood in your urine?
Kidneys.
Kidneys. A lot is to do with the kidneys. They could be a head retroperitoneal or flank. Okay, you need to know that. Make sure you understand that. Are you comfortable with words to do with like a pelvic fracture, or a word to do with a hip dislocation, or a broken hip? Do you know the position of the knee? Okay, don't forget, in dislocation, the knee is more medial, inward. If the knee is outward, it's broken. The knee's inward and up, that leg, think of in, dis, out, break. Got that? Okay, so actually anything to do with the hips. Are we comfortable with the word subcutaneous emphysema in comparison to the word crepitus? Some people confuse those two. If you think of the words like crepitus, grating or grinding sound, that's crepitus. Think of those bones. If you're thinking subcutaneous emphysema, okay, think of the leakage of the air escaping underneath the tissue. Okay, can you say, ask you that? Because a lot of people always get that wrong. When you're checking a patient's extremities, they have a spinal injury. How are you checking the extremities? We taught you a certain way to check it. What are those 3 letters we always tell you to utilize? You do it before and after. PMS, right? Some people use the word post-motor sensory or perfusion motor sensory, okay? You're still checking the neurological functions. If the lower extremities, especially the lower extremities, you cannot do the PMS, you could do the post, but you cannot do the motor sensory, I want you to utilize the Babinski technique. Are we comfortable with the Babinski technique? That bottom of that foot, okay? If it's like this, is that good or bad? You go like this, and it goes like this. Is that good, or this is bad? Which one is good and bad? You're trying to remember, I know that. It's the opposite in like infants or pediatrics, but in adults, if you go like this, with whatever device you're using, pen, pencil, the piece of your shears, and you go like this, and those toes go this way, that's a good sign. If they go this way, that's a bad sign. Okay? So know those just in case they ask you there. Backward here indicate a worse in a technique to do with the neurological damage. So there's certain what they use the words, they're posturing. The 2 posturings you need to know that I always seen on the state, I don't know if they still give it to you in class, that's right, is the corticate and the celebrate. The corticate, okay, they say, oh, that's the best of the 2. The corticate, the other one when the hands are to the side down like this, and the eyes are gazed this way, that's a bad one, okay? So just look at those 2 positions if they ask you that. We already went over VFib and VTAC. We're almost done here. You need to know these 3 besides the words hypothermia and hyperthermia. If I say heat cramp, heat exhaustion, heat stroke, which one is the worst?
Stroke.
Heat stroke. That's a damn true emergency right there. Heat cramps, they say, they'll drink something, help them that contains salt because that's what they have a lack of, electrolytes and so forth, okay? Heat exhaustion, they're still sweating and so forth. They're very warm to the touch, could be hot, but they're not at that heat stroke. So separate each one. Heat cramps, heat exhaustion, heat stroke. Heat stroke, the unconscious unresponses on the floor, they're burning up. That temperature is like 100 and something degrees. I had 4 of them in EMS. 2 died, 2 survived. The best way to take care of a patient with a heat stroke is ice packs. Ice packs right behind there too. So I want you to go behind the neck, in the voids, underneath the underarms, underneath the lower back, the genitalia area, underneath the knees, underneath the ankles. Okay? That's how we did it in the street there. I think the book always follows underneath the underarms and the other voice to do with the lower back and the genitalia. But if you really want to take care of your patient out in the field, think of all that. And imagine if it was the opposite now. We got the heat stroke, right? But let's say it was a person who was in hypothermia. If your ambulance carries heat packs, you could do it the same areas. Okay, know that just in case. What can give you Lyme disease?
Tick
Ticks.
bite.
Tick bites. What else? No. If I remember correctly, and someone double check it for me, because I always could have sworn it was a test question. They always talk about, maybe I'm wrong, but anyone, Ian, anybody, John here, Nick, Maria, any one of you, Harris, I think they call it Rocky Mountain fever.
Oh yeah.
Double check that for me. Make sure I'm correct. Devin, one of you. I could have sworn the Lyme disease was tick bites and also Rocky Mountain fever.
I remember something in the book about
It
that.
says Rocky Mountain fever is caused by tick bites. So
Okay, thank you. It's originated. Okay, thank you very much, Jason. You see, thank you. Because I always saw it in, I don't know. I don't think you're wrong. I think it was in the textbooks to do with Rocky Mountain fever. Okay. Okay, good. I could have sworn I saw in the book under environmental. Double check that because they love to give you environmental questions. Okay. So make sure you know about that. They may give you words to do with snake bites and spider bites. Okay. If they talk about to do with the venom, I want you to know this, especially when it comes to spiders. The brown reclusive, I want you to think it could be when you get bit or the patient get bit or stung by them. It's they use the word cytotoxic. Cytotoxic. Know that word. I always see that on tests. And black widow, neurotoxic. So if I got bit by brown reclusive right here, it's only going to be in this area. Okay, cytotoxic. If I get bit by the black widow, neurotoxic. Okay, throughout the whole body. So know that just in case they ask you. Oh, if they ask you test questions to do with snakes, this is the one I always see. Red on black, let him lack. Red on yellow, kill a fellow. Know that saying in case they ask you that. When I'm reassessing my patient, I do it every what? Depending what type of patient I have. If it's stable, it's every how many minutes? 15. And if it's unstable, every 5. Beautiful. This you must know. You see a spill of a tanker truck that's leaking fumes. You see patients on the floor. Okay? You should be parked where? Say
Like upwind and uphill or something like that.
uphill and upwind. Uphill and upwind. You may see both words or you may just see that word, uphill, upwind. Okay? If there's an accident on the highway, I always like to be a certain amount of feet away from it. Is it behind or in front and how many feet?
It's in front by about 100.
That's what I do, John. Exactly that. I always be in front of it 100 feet or more. That's
For
me.
egress, right? Just to
Not only egress, my safety. I have seen an EMT, and I was on shift that time when he got hit and his partner got pinned. He died, and this was in 1994. This is a true story. You could Google it, okay? Named Prescott. Can never forget the name, okay? And he got pinned because of a drunk driver. Hit a double parked car so hard that it pinned him and his partner when they were putting the patient in the vehicle. Okay. And he died and she survived with broken legs. So you want to be 100 feet in front. That's me. That's how I feel comfortable. According to the textbook, it says 100 feet in front or behind. I prefer in front. When it comes to safety, okay, or the words they like to utilize, what do I mean by hydroplaning? That's right. No friction. That's right. So also state or class questions, we may give you this. When I drive and I need to go through a stop sign or a red light, I must drive with blank blank. What am I saying?
Due regard.
Due regard or due caution. Excellent. Right? That means you come to a complete stop at that stop sign or that red light. You look both ways, back and forth a few times, and then you proceed to that very gently, slowly. Do I cross a school bus with flashing red lights, their arms out, and the stop sign out?
No.
I got a patient dying in the back of my ambulance. So what?
You gotta wait.
That's right. You have no choice. Do I cross a railroad crossing? Nope. You have to remember all this, okay? These are state and class questions they may ask you. Know this. I always see it, okay? This is very important. You need to know all also to do with what is another name for your tech bag? What do we call it? You learned this in ambulance operations.
Jump bag.
Your jump bag, right? Your jump kit, if I remember correctly, or the 5-minute kit. Make sure you know that and understand that, okay? Are you comfortable with your D tank, your E tank, your M tank, your G or H tank? What I mean by that, if I ask you, you need to change your D tank, how many PSIs it must be?
Is it 2000?
That's a full tank. It's 2,000. If you need to exchange that tank, 500 or less. If it asks you this question, and this is always the state, if class asks you this and you see the number 200, that means they're asking you for the minimum safe residue. Remember that word. Minimum safe residue is 200. They don't want you to go even less than that. Only if they ask you the minimum safe residue. If they say when you're going to exchange a tank, it must be 500 or less. Okay, keep that in mind because they'll ask you questions like that. You know it's a 2,000 PSIs you need to have in any full tank that you utilize, especially your D tanks. What does the PISS stand for? Pin Index Safety System. Know that, right? The prongs of number 2 and number 5 represents that you cannot put any type of regulator that belongs to oxygen. Like you can't take a nitrous oxide regulator or flow meter and put it on an oxygen tank. It won't go in there because of that PIS system. Okay, so it's very important you know that and know everything to do with the tank. What is the difference between you knowing cleaning, decontamination, sterilization? Okay. Okay, but you're right. The cleaning we use like soap and water, let's say, right? You're cleaning, you're taking out the dirt and the dust and so forth. Okay, that's according to your textbook also. If you're decontaminating, yes, you're using a form of chemical that's made for that. Okay, like to take out the blood and things like that, or whatever's on your ambulance. Okay, it's made for that purpose. When it comes to sterilization, you're getting more down into like heat and so forth. Like you ever seen a dentist or any places when they're going to do surgery, they do a form of, prior to that, sterilization, or they go down to the micro of it, okay? And they kill all that germs or anything on that, and they open up a new package, and they have all these sterilized instruments. Know all those words. Is there any one of you here who needs anything answered that you feel we didn't go over, that you're uncomfortable with or not comfortable with, that you need to review again? Because we touched base on everything I wanted to touch base on that you need to know for this midterm, okay? I added other stuff in there, okay? But if you go back to this video and you take notes and you know a lot of this, there's no way you fail your midterm. You fail your midterm because you didn't even bother reviewing and studying and going over this, because this is going to help you a lot. Harris, any questions? Nick, anybody here? Maria? No? Everybody sign in?
Was that just that poll you sent?
That poll I sent out before is for you to have signed in earlier. If you
Okay.
sign in earlier, well, let me look at it because I forgot to. So it shows me that about 16, 17 of you signed in and everybody's good. I got 16 for 16 and I got everyone here. So that's a good thing. So I'll see everybody's name there and I'll take care of it and then I'll send it to them that everybody was here. How many of you are left in class? That's not okay. That's not too bad. That's not bad. You started with what?
Yeah, it was in the 40s. It was a lot.
Yeah, it always happens like that. Don't feel bad. Sometimes it breaks down to half. Okay? It all depends. Well, I'm telling you this right now. If you got a GPA of 75 or better, if they're still doing it like they used to do, even if you fail the midterm, depending if they keep you or not. I don't know if they still do it that way. Do they still do it that way? Okay. All right. Just want to make sure. If you are all done with me, I am done with you. I want to thank you, like always, for the opportunity. I'm going to stop this recording now so it can upload.
Recording stopped.
And then I'll send it to you all